Hi, I'm Dr. Samantha. I'm a naturopathic doctor that specializes in hormone health and fertility, and today we're going to talk about a specific fertility case that ended in a pregnancy. I think there is value to talking about cases because a lot of times as I share cases, people see themselves within that case. So one, they know that there can be something done for their specific case. And two, there's some hope. I do know that hope can be a little bit dangerous in the infertility world, but at the end of the day, I do think having some hope is definitely better than having it be completely demolished. And I've heard a lot of stories, and that can happen often in this world. So today, like I said, we're going to be talking about a specific case. Now, usually we give like age, demographics, so I'm giving some of those things. Again, this has to all be HIPAA compliant, so I can't give any like distinguishing factors. But what I can tell you was this case was a fertility for two case. So in my practice, that means I treat the female and the male. Both were in their mid-30s, and the female had PCOS and hypothyroidism, and the male had low motility and low morphology. So in the beginning, we can see that there are multiple factors already, right? PCOS and hypothyroidism and the issues with sperm quality. So at the end of the day, we can see that they're very clear examples of what's going on. I have a lot of unexplained infertility cases, and I'm actually thinking about talking about one of those too, if you guys like this style video. As you can see, there's some things that they were already working against. We also did a deep dive. So my first visit is a 60-minute evaluation where we talk about diet and lifestyle and medical history and menstrual history. And basically we review everything that possibly could relate to the fertility, including what they're already going through, like PCOS and thyroid issues, but then also, is there a gut health issue? Is there skin health? Is there a family history that could actually impact fertility? Long story short, we spend a lot of time reviewing a lot of details about both partners' life, so male and female side of things. After we do that, I come up with a plan on lab work that I would like to have done. Those usually include the basic hormonal labs. I do have videos on labs that I like to get, and a lot of times it also includes gut health now. In the beginning of my practice, I didn't request gut health labs as often as I do now, but I've just seen them play such a major role in fertility. It's hard to not do it because at the end of the day, even if everything's okay, at least we rule that part out, and so we don't have to worry about it later on. Also, those with PCOS tend to also have gut health issues, so it's definitely something I'm going to order for the female in this side of the case, right? So order the gut test. For the male side of things, we just left it. I was like, we can do that later for you if needed. So right now we're treating the female for PCOS and hypothyroidism. She is on medication for hypothyroidism. For the PCOS, she was getting very irregular cycles every day between 45 and 60 days. That's usually the average for most of my PCOS clients or patients. And so our goal is to have ovulation occur and have a more regular cycle, as well as keep that TSH below 2.5 and have TPO antibodies that are also below 15. Those were our goals. What did we do for her, right? So for the PCOS, I have a special herbal protocol that I put people on and I see great success with. Again, I think all these things should be monitored though. That's why I don't just like list all these protocols, because some people also think they have PCOS when they don't, so the protocol could do more harm than good. Sorry, total tangent. But anyway, we did a PCOS herbal protocol. We definitely gave some love to her egg quality. Treated gut health. She ended up coming back with candida as well as H. pylori, so treated that. That was super beneficial because not long shortly after treating the gut health, she did actually conceive, and that was in her third trimester. So we did a lot on her side of things. We also worked on the male side of things. So we worked to improve motility and morphology. This is a supplement protocol that contains a lot of antioxidants. I do really like ashwagandha for males specifically. It also helps with stress. And so we also added that into the protocol. And then both of them did this consistently for at least 3 months. And then we got new labs, saw that those were good, continued to work on the gut health. And then, like I said, they actually shortly conceived after. So we didn't even have to go longer than the 6-month mark, which was pretty exciting. I feel like I might have bounced all over the place, so maybe for the next video I might have a little bit more structure for this, but ultimately I think it's a really cool to hear and see cases like this, because like I said, you might be able to find something in this case and be like, wow, I have some of those same things happening in my case and it's not hopeless. I don't ever like to provide false hope, but at the end of the day, I do like to just show that even though people have told you that your only hope is IVF or IUI, maybe that isn't the case, and maybe you can conceive naturally. You just haven't been given the right tools yet. So this is a very simple, short video, and if you have any questions or if you like this video, please give it a thumbs up. Please ask questions. Please ask if I have any other example cases. Honestly, I see hundreds of fertility patients. I have seen so many cases. It's very rare for something to surprise me or for it to be something that I haven't seen before. So please reach out, please ask. I think it's always really valuable to learn, like I said, that there can be something done for it. So this case, just to remind you, mid-30s, I forgot to say that they had also been trying for over 3 years. So that's a pretty long time, and they had been told that like IVF was their only route. So it's pretty cool when you hear it like that, because they had been told all these things and were fighting this uphill battle for forever, and then we finally got their bodies and systems back on track, and the magic was able to happen. So if you're here, you're probably trying to conceive. So I just want to say I'm sending you so much love on your journey, and I hope you have a beautiful rest of your day.